Thanks very much, and one more time, thanks for inviting me. Hybrid therapy with the treatment of the common femoral in my practice is the majority, again, as I said, of what I do. Common femoral disease itself is often bulky, heavily calcified, often very eccentric, as you saw in this case, and often involves the bifurcation. It's associated frequent times with disease both above and below the common femoral artery, and rarely by itself does it cause symptoms. It can, but it's rare that you see a patient who just has common femoral artery disease with extensive symptoms. And in my opinion, it can be easily and safely treated with endarterectomy, usually with some form of hybrid therapy. Common femoral artery endarterectomy has been looked at, and this is an older study, now almost 15 years old. This is 117 patients from a single institution, about 40% of these for critical limb ischemia, 60% for claudication. They had 100% success, no mortality or major morbidity, about 6.5% wound issues, and for 8 of these, lymph leak, and that's probably, in my experience, the most common issue, and often can be treated with outpatient therapy, just with a vac dressing over the area of lymph leak. Endarterectomy results, you can see here out to 7 years. These patency rates are very good. Primary assisted patency of 100% out to 7 years. Primary patency a little bit lower. It's not unusual to need to treat either lesions above or below the area that have been treated before. Again, just another look. This is from Germany. 6 years, over 700 vessels treated. Again, a pretty good distribution of critical limb ischemia, but the majority of these are done for claudication. These surgeons used Dacron patches with a primary technical success rate of near 100 and wound complications in 8.5%. About 60% of these required surgical intervention. I would say that's much less common in the current era than it was in the past. Patency rates for this study you see here out to 8 years. Again, well over 90%, almost 95% patency in these patients. Intervention for common femoral disease has been looked at in a number of different papers. The last of these, or the lowest of these in this table, from the VQI, over 1,000 patients on 90% technical success. Primary patency at a year of close to 85%, and catheter-directed TLR 15% at 12 months. Really not long-term data available for any of this. There are a number of studies that have looked at not direct comparisons, but assessments of outcomes for femoral endarterectomy and looked at the proposed treatment of this with intervention. And the bottom line is femoral endarterectomy remains the standard of care. It has intervention has a lower peri-procedural complication rate, but is associated with reduced primary patency and more frequently requires reinterventions. You saw the TECO trial, almost 120 patients, delayed wound healing in 15% of the patients with surgery, paresthesias, which are not uncommon, local infection in 5%, no rupture, some rupture in the patients who had intervention. Again, this is just a 24-month outcome. I think that's not what any of us really believe is long-term data to look at success with this. But clearly there is a role for intervention, particularly in patients who have contraindication to surgical therapy. Common femoral artery disease, in my view, it's a bulky, complex disease, often at the bifurcation. Surgery works incredibly well and provides a foundation for hybrid revascularization of either the SFA or the iliac system. Preservation of the profunda femoris is critical. There are studies that have looked at stenting across the femoral bifurcation. They show good or reasonable patency, I should say, of the SFA, but there's never really a good assessment of the profunda. You lose the profunda and the SFA goes down, you will lose the limb. While stenting deserves evaluation, the standard of care remains endarterectomy and profundoplasty in my view. Thank you very much.